Mr. Detlef Loppow, Geschäftsführer von der Martini Klinik in Hamburg. We've talked to each other before, but first of all, can you explain us a little bit about how you use value-based healthcare in the Martini Klinik in Germany in order to get to excellent quality in healthcare?
Yeah, the Martini Klinik in Hamburg is a part of the University Hospital in Hamburg, and we use value-based healthcare in terms of we ask our patients for the patient-reported outcomes, and we're a specialized clinic, so we only treat patients with prostate cancer, and finally the patient receives better quality in our hospital because we have learned a lot of the patient-recorded outcomes and changed many factors for the surgical techniques and so on over the last years.
And it's a continuous learning improvement.
Yeah, it's a continuous circle of learning, of improvement, and every 6 months our surgeons sit together and have more than 60 slides to compare their individually achieved outcomes in their patients, and they see whether they've become better, become a little bit worse. Young surgeons see how they improve and become close to the results of the more experienced surgeons. That's the way it works in our clinic.
So this value-based healthcare in this organizational perspective works out very well for you. Well, we've seen the numbers. The big improvement is not possible anymore because you're already very high in the levels. How do you see the next improvement?
For us, the next improvement will be a new building. So we will size what we have done now. We're going to build a new prostate cancer center with 100 beds and 8 ORs and so on, and we will be happy to work there in the end of 2020. So this is our perspective. And in terms of quality improvement, we will for sure continue to measure outcomes. We will continue to work according to this ICHOM standard set for localized prostate cancer, and we will still work as this integrated practice unit as described by Michael Porter. So every patient who suffers from prostate cancer will get the best recommendation, whether for radiation therapy, for active surveillance, for focal therapy, for surgical therapies, or whatever. We have a so-called centralized expertise for prostate cancer treatment in our hospital.
Well, your clinic is specialized in prostate cancer, you're already saying that. How can we get to the next level of prostate cancer treatment? Not just in your clinic, but in clinics in Germany, but also in the other countries, like, for example, the Netherlands.
Well, I think not only concerning prostate cancers, it's for every kind of treatment where you can specialize. For example, where an ICHOM standard set still exists, you should try to build up specialized practice units and implement the infrastructure for outcome measurement. And instead of debating what should be measured, I think it's easier to start quickly using the already defined standard sets for each disease and be faster in implementing this. And then you will make your own experiences, and then you can adapt some variables maybe. Yeah.
So stick to the universal outcome measurements and learn from each other and well, share your finding.
Yeah, share your outcome results. Compare yourself with other hospitals who do the same, who do the measurement to the same criteria, and then go into the dialogue. So look what are other clinics doing better, learn from each other, and inform the patient. I think the most important thing is that the patient needs to have an information platform that he knows which outcome he can expect for which treatment. Yeah? nowadays, no patient, if a patient has breast cancer, he can choose a doctor because it's a nice guy or it's a senior doctor. He seems to have a lot of experience. But there's no proven outcome quality for each doctor or for hospital or however. So this is the lack of our healthcare systems.
Yeah, we all have to look at the patient. Thank you very much for your interview.
You're welcome. Thank you.